I was born and raised in Galveston, Texas. My dad's a physician. My mom and dad actually met doing gymnastics. My dad was a gymnast for the University of Texas, and they met and they had a big gymnasium. And so, believe it or not, I used to be a gymnast. You can't tell by my size now, but I used to be a gymnast. But basically, we grew up in Texas, went to Catholic school all throughout, Catholic private school, O'Connell, and was a great place to live, beach, loved to fish, loved to do things like that. My brother's an anesthesiologist. He's the president of his medical group, very successful, fantastic physician. My dad was an MD, PhD, and a funny story about my father is my father actually taught me. My dad was on faculty at the University of Texas medical branch for 57 years. He actually taught Dr. Poteet. He taught several of the doctors that are here. My dad passed away about 2 years ago, and I was interested in medicine. My dad never really forced my brother and I to go into medicine, but I was interested in medicine because my dad was a renal transplant recipient. And so before I became a radiologist, I actually was a urology resident because I was planning on doing renal transplant because I was very interested in when my dad was going through that. I used to do home hemodialysis on my father, and I was very interested in kidney function, kidney disease. And so basically, I went into urology and I realized that doing cystoscopy every day is not my cup of tea. And so I never quit anything in my life. And it was very hard for me to stop doing urology. But I made the choice that I was going to stop. And I called Galveston and asked if they had a spot in radiology, and they accepted me on the phone call. And that's how I became a radiologist. I graduated when I was 17 years old, and I went to Texas A&M University. Graduated with a double major and a minor in Spanish. A&M was a great school, prepared me very well for medical school, and I think I had a great education, and I would recommend to everybody to go to A&M. Don't go to Texas. I did 4 years of radiology at UTMB, and then directly from UTMB, I came to King's Daughters Clinic, which is now Little River King's Daughters Clinic. And we live in Georgetown, and it's a fantastic place to raise a family, and we love it here. Well, my favorite part about my job is I'm a doctor's doctor, and what that means is I have to get involved with every specialty there is here: neurosurgery, orthopedic surgery, OB-GYN, family practice, internal medicine, and I have to help guide them to take care of people. And basically, I love to interact. One of my favorite things to do is teach. I taught gross anatomy for 7.5 years, and to sit down and teach people about what I see, what I know, and not only teach, but when you talk to people about things, you actually learn things from them. And I've learned a lot from different specialists here. Things that I wouldn't learn in radiology residency. And it's been very enlightening, and so teaching is my forte, and eventually that's what I'll do for the end of my career. What brings a smile to my face every day, it's very stressful. I read lots of mammography, and most radiologists don't want to read mammography because it's very dangerous and very hard to do. Because no breast is the same. Every breast is different, and the breast parenchyma is different and everything, and it's hard to pick up breast cancers. But the most excited I get is I don't get excited about finding breast cancers, but what I do get excited about is when I find them and they're less than a centimeter and they can be excised and the patient's cured. Then I felt like I did my job, and that's a very rewarding feeling. I can tell you a story that I was in an elevator in Seton Hospital about 4 weeks ago, and I walked into the elevator, and a lady got in with me, and the door closed, and I pushed the button to get to the second floor, and I was standing there, and she turned to me and she kissed me on the cheek. I'm like, what is this? She said, "Dr. Callas, do you remember me?" I said, "I'm sorry, I don't." And she gave me her name, and she says, "I want you to know you saved my life." and that's what medicine's all about for me. And so, that's where I make the biggest difference, I feel. My wife, who is the most fantastic, understanding person that you can imagine, she has been understanding through my residency, through medical school. I actually met her in medical school. She was a year behind me, and she decided she wanted to be a doctor, and so she left medicine. And she's been with me since residency, since medical school. She's tolerated a lot. She's tolerated a ton of me being away from home. I've been president of King's Artist Clinic, president of Little River Medical Group, and that takes a lot of my time. And unfortunately, she's the brunt of that, and sometimes she has to be a single mother. I'm not happy about that, but it's just the job that I live. My wife is the most important person to me in the world. I have 2 beautiful kids, Carson and Ava, fantastic kids, very smart, very outgoing, just great kids. My family is my life. I almost went to MD Anderson to take a job there, but my wife didn't want to move, and because I want to get back into academics one day, and she runs the show, and she tells me where I need to go and where I don't need to go, but she's been very supportive of me, and I love my family dearly.